How does transverse myelitis relate to NMO? Imagine a condition that affects the spinal cord and optic nerves, causing sudden weakness, numbness, or even paralysis. That condition is often linked to transverse myelitis, which is a key feature of Neuromyelitis optica, or NMO. Transverse myelitis is an inflammation of the spinal cord that can cause symptoms like pain, weakness, or loss of sensation. In NMO, this inflammation usually extends over 3 or more adjacent vertebral segments, which is called longitudinally extensive transverse myelitis. This pattern is quite different from what we see in multiple sclerosis, where spinal cord lesions tend to be shorter and more scattered. This difference helps doctors tell NMO apart from multiple sclerosis. NMO is an autoimmune disorder that mainly targets the optic nerves and spinal cord. The presence of transverse myelitis in NMO is one of the main signs used to diagnose the disease. Unlike multiple sclerosis, NMO is strongly associated with antibodies called aquaporin for antibodies. These antibodies attack a water channel protein found in support cells of the nervous system called astrocytes. Most people with NMO test positive for these aquaporin for antibodies, which helps distinguish NMO from multiple sclerosis. To diagnose NMO or neuromyelitis optica spectrum disorder, doctors look for at least one core clinical feature, such as transverse myelitis, along with a positive aquaporin for antibody test. They also rule out other possible causes. If the antibody test is negative or unknown, then the diagnosis depends on having at least 2 core features, like transverse myelitis with long spinal cord lesions seen on MRI. These lesions extend over 3 or more vertebral segments, which is a hallmark of NMO. In contrast, multiple sclerosis usually shows shorter, patchy spinal cord lesions. While both multiple sclerosis and NMO involve immune system attacks on the central nervous system, they are different diseases with different underlying mechanisms. Multiple sclerosis is characterized by immune cells attacking the myelin sheath, the protective covering of nerve fibers, whereas NMO involves antibodies targeting aquaporin for water channels. This difference influences how each condition is treated. For example, some medications used for multiple sclerosis can worsen NMO, so accurate diagnosis is very important. In summary, transverse myelitis is a core feature of NMO, especially when it appears as long segments of inflammation in the spinal cord. Recognizing this pattern helps doctors distinguish NMO from multiple sclerosis and guides appropriate treatment. Understanding these differences is essential because managing NMO often involves immunosuppressive therapies aimed at reducing antibody production, which is different from the treatments used for multiple sclerosis. Always consult healthcare professionals for personalized diagnosis and care, as each person's experience with these conditions can vary.